The ADAPT-TAVR study was a randomized open-label trial with blinded adjudication of study endpoints conducted in Asia and powered for superiority. The investigators randomized 229 patients undergoing TAVI and with no indication to chronic oral anticoagulation, to the direct oral anticoagulant Edoxaban, or to dual antiplatelet therapy with aspirin and clopidogrel. The primary endpoint was assessed at 6 months with cardiac CT and was the incidence of valve leaflet thrombosis. The key secondary endpoint, also powered for, was the number of new lesions on brain MRI between 6 months and post-procedure. So valve leaflet thrombosis at 6 months was detected in 9.8% of patients on Edoxaban and 18.4% of patients on dual antiplatelet therapy, a difference that was not statistically significant with a p-value of 0.076. New cerebral lesions at brain MRI were found in 25% of patients on Edoxaban and 20.2% of patients on DAPT, and this difference was also not statistically different. There were also no differences in the worsening of serial neurological testing, neurocognitive function, clinical outcomes, including bleeding. And very importantly, there was no association between subclinical leaflet thrombosis and neurological outcomes. What are the implications? Subclinical leaflet thrombosis is an imaging phenomenon that does not seem to affect clinical outcomes and probably should not mandate routine screening or dictate the antithrombotic therapy for prevention or treatment after TAVI. These findings indirectly reinforce the current recommendations from the ESC guidelines that in TAVI patients with no indication to oral anticoagulation, aspirin monotherapy is the standard of care.